All right, let's talk about something we all think we've got a handle on, our health. But here's a wild thought. What if the biggest thing shaping how long you live and how well you live isn't your genes, but your street address?
Okay, let's really get into this. I know, it sounds like a total exaggeration, right? But get this. In some cities, your life expectancy can literally drop by a whole year for every couple of miles you travel away from the richer parts of town. And no, that's not just bad luck. It's actually the result of systems and policies that create, well, really unequal chances for people to be healthy.
I mean, just think about it for a second. Your address pretty much decides if you can get fresh, healthy food nearby. It decides if you have safe parks to go for a run, or if your kids have clean sidewalks to walk to school on. It even impacts the very air you're breathing. People call this the postcode lottery. And honestly, its effect on our lives is, well, it's huge.
So, let's dig into this idea of the postcode lottery a bit more. And you've got to understand, this isn't just a problem in one or two places. It's a massive challenge for public health all over the world.
And this quote from the World Health Organization, man, it just hits the nail on the head. The real problem isn't just that people get sick, it's that there are these huge systemic barriers stopping entire groups of people from even having a fair shot at a healthy life. That's what we're talking about when we say health inequity. It's not about forcing everyone to have the exact same health, it's about giving everyone an equal chance to be healthy. Okay, so if it's not all about doctors and hospitals, then what is it? The WHO says we've got to look way beyond the doctor's office. And this next part really shows us the bigger picture of what actually makes us healthy.
Right. The big goal here is what's called health equity. And let's be clear, this isn't about making sure everyone has the exact same level of health. I mean, that's impossible, right? It's really about making sure that every single person has a fair shot, a just opportunity to be as healthy as they can possibly be. It's all about removing those unfair obstacles.
Okay, now this is what I find really fascinating. Check out this breakdown of what actually shapes our health. You see health services there? That's what we all think of first. Doctors, hospitals, right? But look, it's only one piece of the pie. Just as important is stuff like your income and social protection, having a living wage, or benefits if you lose your job. Then you've got your living conditions, the quality of your home, your neighborhood. Social and human capital. That's about education and having people around you that you can count on. And finally, your job and working conditions. Is it stable? Is it safe? Health isn't just made in a clinic. It's made across all these different parts of our lives.
So, okay, we get it. Health is super complex. It involves all these different sectors. But how on earth do you begin to fix a problem that big? Well, to try and tackle this, the WHO came up with a really systematic approach. And that's what we're really digging into today.
It's called the Health Equity Policy Tool, and you could almost think of it like a diagnostic kit, but for a whole society. It's designed to help governments look past just the Department of Health and start seeing how everything is connected, like how a new bus route policy might actually be linked to something like childhood asthma rates in a specific neighborhood. It connects the dots.
But it's one thing for a politician to announce a new policy. How do you know if it's actually doing any good? That's where this tool is really clever. It has a two-part approach. On one side, it looks at the action. Basically, is the government walking the walk? Are they passing laws? Are they putting money where their mouth is? And then, on the other side, it measures the result. Are those policies actually reaching real people and making their lives better? It's all about connecting the political promises to what's happening on the ground.
Okay, that all sounds great in theory, but what does this tool actually measure? Like, what are we talking about here? Let's get into some real-world examples to see how it works and how it builds a much clearer picture of what's going on in a community.
So let's start with one of those 5 big areas we saw in the chart, our living conditions. Now the tool looks at all 5, but we're just going to zoom in on a couple to give you a feel for how detailed this thing gets. And we'll start with the very environment we live in.
So the tool starts tracking things you probably wouldn't expect to see in a health report. Like, can you afford to actually heat your home in the winter? Do you feel safe walking around your own neighborhood after dark? Is there decent public transport to get you to work? You might think, okay, those are social issues. But what this tool shows crystal clear is that they are absolutely powerful factors in our health. And this quote right here explains exactly why. Just picture it. A kid growing up in a damp, moldy apartment. Their risk of getting asthma is way, way higher. And that's not some personal failure, right? It's a direct result of their environment. And think about the constant stress on their parents just trying to make rent. That has long-term health effects on the entire family. You see, it is all connected. All right, let's switch gears and look at another huge area the tool examines,
Our jobs. I mean, we spend so much of our lives at work, it's really no surprise that our working conditions can have a massive, massive impact on our health.
What the tool does here is it zooms right in on the parts of work that create chronic stress, which we know is just a killer when it comes to health. So it's not just about, do you have a job? It's about what kind of job you have. The big question it asks is your work a source of stability for you, or is it a source of constant gnawing anxiety?
And believe me, the stakes here are incredibly high. That constant stress from a shaky, low-quality job, it isn't just a bad feeling. The evidence is overwhelming. It's directly linked to real, serious physical problems. We're talking heart attacks, strokes. Your job can, quite literally, break your heart.
So, we've seen a bit of how this tool works. But you might be thinking, okay, but why does this matter to me? I feel fine, I live in a decent neighborhood. Why should this matter to everyone?
What this all really boils down to is a massive shift in how we think about health. For so long, we've been looking for it in all the wrong places. Look, you can build the most advanced hospitals on the planet, but if people are showing up because their homes are making them sick and their jobs are grinding them down, we're just fighting a losing battle. Real health is created in our communities, in our homes, and at our workplaces, long before anyone ever has to see a doctor.
And really, here's the bottom line. Just imagine a society where fewer people are dealing with chronic illness because their environment actually supports them being well. What does that get you? It means a more productive workforce. It means way less strain on our healthcare system. It means communities are just stronger, more resilient, better able to handle whatever comes their way, whether it's a recession or a pandemic. This isn't a zero-sum game. It's not about taking from one group to give to another. It's about building a stronger, healthier foundation for absolutely everyone.
And that really brings us to our final thought for today. The big takeaway from all this is that our health is basically a story, and that story is written by our environment. So the question I want to leave you with is this. Just take a look around your own world. Your commute to work, the grocery store you shop at, your office or job site. What parts of your world are helping you to thrive, and what parts might be holding you back? Because figuring that out, that might just be the key to a longer, healthier life for all of us.